This is Jerry Hesch of the Hesch Institute, and this is a very brief client interview. This client had a supinatory injury, and her ankle, foot and ankle, would not pronate. This occurred several months after she had a bilateral bunionectomy. She's 29, quite young for that surgery, but she had severe bunions on both sides and had very successful surgery, but upon resuming activity, progressively the foot and ankle became more and more symptomatic. I'm going to let her tell her story very briefly, and I'm very pleased in one visit we made a significant difference by treating several joints in her foot and ankle to restore normative mobility. So go ahead and tell your story, please.
Sure. So as Jerry mentioned, I had bilateral bunionectomy in June 2012 and started running again, no problem, in January of 2013 of this year. And a couple of months after I started running, just jogging for about an hour at a time, sometimes most of the time less, I started getting lateral foot pain on my right foot, and started getting pain all the way up the side of the little toe, and my little toe and my fourth toe, I would get weakness in them and didn't feel like I could move them very well, and also had pain coming up behind the heel and up the peroneal muscles on the side, very tight muscles, very painful, and so for the past several months, since March at the onset of the injury, my walking has been extremely limited to about 5 to 10 minutes maximum, which was the amount of time it took me, or took the pain to begin, and have been out of commission, I would say, for the past several months. I tried, I first saw an orthopedic surgeon who suggested I do PT. I then commenced PT. That did not work because the first PT did not actually want to mobilize or touch the foot or ankle. It was mostly Pilates. The second PT that I saw started working on various aspects of my big toe, thinking it was big toe stiffness, or then it was the ankle that was locked, or then it was just I was walking funny and that was why this was happening. And then my gluteus medius was too weak, and so I was popping my hip out, and that might be causing my injury. So I went to about 20 sessions with her, which did not change anything. At one point she did mention my cuboid bone and that might have something to do with it. And I did some research online because I had been having pain in the cuboid region and around that part near the ankle, the lateral ankle, and found Jerry's video on YouTube that suggested that there's a more complex cuboid syndrome that can exist and needs to be treated. And so I came out here, and yesterday came for my first visit. This is my second visit today. He identified that the subtalar joint and several other joints were locked and not moving at all, and that I was not able to put weight on my big toe because that joint was locked, and proceeded to unlock everything. And now I can actually feel my foot splay when I walk, my big toe on the ground, and kind of the pressure and the weight being spread out laterally as well. And I walked last night on the treadmill for about 10 minutes, and the pain did not come up into my little toes or along the side of my foot. So I think I'm on the road to recovery, and looking forward to resuming activity in a few weeks.
Thanks very much. I appreciate it.